Thank you very much, Permanent Secretary, Minister of Health. We are here to welcome our guest from Global Fund. And of course, they will tell you a little bit of why they're here. But what we want to show is that as a government, we really appreciate the work and the collaboration that we have been having with Global Fund. A lot of support have been trickling. And of course, especially when you see the impact on the grassroots in the Gambia in terms of health, our healthcare system. Everything that you see today in terms of development, so that definitely they have been very much the hands of Global Funds there. And then we have the CCM here with us, but definitely they are here to meet the President tomorrow for the launching of a grant. And this is one of the very important issues, the reason why we are welcoming them here today. So on behalf of the Honorable Minister, Dr. Samate, who himself would have loved to be here, but he is engaged elsewhere, we would like to welcome them and allow them just to have a few words. Thank you.
Thank you very much. My name is Adafai. I'm the head of the delegation, accompanied by Ms. Katifal Sow, the head of the Africa and Middle East division of the Global Fund, and Deborah, the fund portfolio manager for the Gambia. We're here to launch our grants for the next 3 years. And for those of you who don't know, the Global Fund is a fund that provides grants to countries mostly in Africa to fight HIV, TB, and malaria. The partnership with the Republic of the Gambia has been going for the past 20 years. And this is a very important milestone because it is the first time we are starting to relaunch grants post-pandemic, and we all know the impact of COVID and health in the economy of the people. So we are here for the people of the country, and we thank the government through His Excellency, the President, but also the Minister of Health and the PS, the CCM, for welcoming us. Thank you very much.
We talked about grants. How much are we talking about?
The grants. We would love to keep the amount for Friday, but what we could tell you is that over the last 20 years, the Global Fund and the government of the Gambia, the partnership, we have invested over $200 million in the health sector. And it has gone a long way in improving the health and livelihood of Gambians, especially in malaria. Yeah. Thank you.
Is there any other area that you want to focus on in this time?
This is 2024 is very important in the sense that you can think about HIV, TB, and malaria as standalone diseases. However, when you look at it from a primary health care perspective or universal health coverage, we have started over the last 2 years to invest in a lot in strengthening the health system of the country. We have invested in oxygen plants to provide oxygen for people in need in the hospitals, but also a lot of investment in lab system strengthening, community health workers, among others that we will talk about on Friday.
After the head of the delegation has spoken, but just to say many, many thanks to the Ministry of Health for this very warm welcome. We know that Gambia is the land of smiling people, so we've come and found the warmth of Gambians. We've been working with the teams here, not only in Ministry of Health, but also civil society organizations for the last 2 decades. And we're hoping that the partnership over the next 3 years is going to deliver even more impact than it has in the past. Thank you.
Let me allow the CCM, who has been working with them very closely for a long time, maybe he'll be in a better position to really dilate on that.
My name is Bai Cham. I am the Executive Secretary of the CCM. That's the Country Coordination Mechanism of the Global Fund. As rightly stated by the head of delegation, that the Global Fund has been investing for the past 20 years in the Gambia. And in that, it has enabled the country to stabilize HIV. The prevalence of HIV has been stabilized. For a long period, it didn't go up. And we are even working towards eliminating malaria in the Gambia. And we have gone too far into that. In terms of TB, we are increasing diagnostic and effective treatment in the TB program. And we hope that with the new investment, health systems will be further strengthening to the extent that access to healthcare will be provided across the country.